The Positive Pause is a motivational-minded podcast covering topics women want to know about as they journey to and through menopause, focusing on subjects that impact women's health and healthy aging, including what it means to age healthfully. The Positive Pause features experts and influencers from a variety of industries and specialties. The information and opinions expressed on the Positive Pause are not intended to replace the services of trained professionals or to provide specific medical advice. To see the National Menopause Foundation's full medical disclaimer, please visit nationalmenopausefoundation.org.
Welcome to the Positive Pause. I'm Claire Gill, founder of the National Menopause Foundation. Today, I'm delighted to invite back to the Positive Pause our Medical Advisory Committee member, Ingrid Harm-Ernandes. Ms. Harm-Ernandes has been a physical therapist for more than 38 years and began specializing in women's health more than 2 decades ago. She is board certified in women's health and pelvic floor biofeedback. In 2021, she published her book, The Musculoskeletal Mystery: How to Solve Your Pelvic Floor Symptoms. Women have so many questions about their pelvic health at midlife. She has been a featured guest on several national and international podcasts, and I'm delighted to welcome her back to the Positive Pause. Thanks so much for joining me again, Ingrid.
Oh, thank you for having me. Looking forward to our discussion as always.
Thank you. Thank you. So we spoke about this last time you were a guest, but let's refresh people's memories, or for those listening about this topic for the first time. What do we mean when we say the pelvic floor, and what parts of the body does that encompass?
Great place to start, because I think that's a point of confusion for a lot of people when they just hear the term pelvic floor. Like, what is that? So basically, if we look at the musculature and the fascia of the pelvic floor, we're looking at a sling or a hammock that exists between our tailbone and the bone in the front of our pelvis, and then side to side to what we call our sits bones, the bones we sit on in our pelvis. So it creates a hammock or a sling, if we want to look at it that way, that holds up all of our organs through our life, no matter what we do. So it has so many important functions. It has to control our bowel and our bladder. It controls the support, like I was talking about. It's an integral part of our whole core, where it works with other parts of our body, including breathing and even our voice. So it has quite an impact on our entire body, which is kind of hard to believe. It also has a sexual function. It allows us to have intercourse. It allows us to have comfortable and enjoyable intercourse. So there are all these different features. It's a sump pump. It helps pump fluid out of the area so fluid doesn't congest down in the pelvic floor. And I could go on and on, a birthing process. So you can see that it's a structure that we don't see and gets very ignored, yet is responsible for so many different activities and so many different parts of our life. So people need to look at it as not just, oh, there's a couple muscles down below. It really has a very, very important function on so many different, or an impact on so many functions of our life.
It's especially things like you said that we completely take for granted, right? We don't spend a lot of time thinking about how the whole process of the bowel and all of that works. And then when you realize, again, the importance of this area, we always just think about, like you said, it's kind of serves a sexual function, and that's it. And that is not what we're talking about. And certainly as we age, you start to learn a little bit more about that, especially if you come to the point of menopause for women and then start to experience some issues with it and realize that it really is super important. And it's something not only for women at menopause to pay attention to, but certainly throughout the life. So some of those pelvic floor issues that we talk about that are very common during menopause can include everything from incontinence to sexual dysfunction, right? So what can younger women do now to help prevent potential issues later in life? And then what can women currently experiencing menopausal symptoms do to alleviate some of those that are impacted by their pelvic floor?
Yeah, that's a loaded question with a lot of moving parts, I'll say. So there's something that I have coined, I guess, a term of, it's a continuum of life through the menopause phases, right? So perimenopause, menopause, postmenopause. And I think maybe the first place to start just like people not quite understanding what the pelvic floor is not understanding how many different kinds of symptoms occur during perimenopause and menopause that we actually don't relate to it. So we don't even ask for help because we've been told, just go live with it. It's part of menopause. You leak a little bit, you have pain with sex. Yeah, live with it, have a glass of wine, whatever the comments are. And it really dismisses women during this huge time period of their life. So maybe starting with a little bit of a recognition of something that they're finally kind of looking at and studying more. And it's the musculoskeletal syndrome of menopause. So what that means is it encompasses many body parts of the musculoskeletal system that before were not really investigated, and now we're thinking about it. So it would mean, for example, inflammatory processes that involve joint pain, muscle weakness, a loss of our skeletal muscle, which is actually quite large during the menopausal years. And that's something that wasn't really recognized before. Bone loss, balance loss, all these things are involved. But there is one component that even this newest paper doesn't look at, and that is the pelvic floor component. And we discussed before how the muscles or the pelvic floor are a grand group of muscles that have a huge part of our life that or impact a huge part of our life. What we don't look at is, okay, so this same syndrome that we're talking about doesn't really talk about the pelvic floor specific. It mentions genitourinary syndrome of menopause, and we can go more in detail at that at one point, but it doesn't really talk about, hey, while you go through this time frame, you might have incontinence. That could be urinary, peeing. It could be pooping. That's fecal incontinence. It could be prolapse. It could be constipation. It could be pain with sex. I could go on with all the different things that aren't even talked about in this paper directly. So I think what women need to realize is that during perimenopause, which occurs much earlier than a lot of people think, and the reason why I call it continuum of life, if women are having babies later in life and they go through postpartum, which is really fourth trimester, a lot longer time period than people think. And before they know it, they're in perimenopause, and then they're in menopause and in postmenopause. So sometimes these symptoms are decades, which also makes us kind of think, well, it's just part of life. I live with it, right? So if someone's recognizing that they have incontinence of some sort, they have pelvic pain, they have prolapse, they have other kind of things that occur during this time period, we should immediately say, either I need to address it with something like, you were asking like what to do, pelvic floor exercises, correctly doing a contraction and relaxation. And if at all someone can't sense what that is or is having pain with it, they need to go to a pelvic PT, right? That's a big red flag is, pelvic physical therapy needs to step in right now, or I need to see a urogynecologist for further assessment, my OBGYN for further assessment. You know what I'm saying? So it's kind of like, try to get that help earlier rather than later. And then some of the really basic things for everybody is be active. And what I mean by that is I don't like to say, go do exercise, because the connotation is exercise. No, I don't want to do that, right? Instead is pick something you would enjoy. It might be a walk in the park. It might be a walk, in your neighborhood. It might be doing gym exercises. It might be doing some elastic exercises at home. You know what I'm saying? It's things that you should find you can fit in your life relatively easy, because weight bearing activity, good for your bones. Any kind of activity, good for your muscles, good for your pelvic floor. Your pelvic floor activates and works with every activity you do. If you do diaphragmatic breathing, that's deep breathing through the nose and blowing out through the mouth, that actually activates the pelvic floor, because the diaphragm and the pelvic floor work in tandem. That goes back to our little conversation before about the core and being part of the core, is that if we activate other muscles, our abdominals, our diaphragm within our core, we get our pelvic floor going and vice versa. So having your pelvic floor strong can help your back, right? It supports your back. Sounds wild, but it is so, so very true. So I think one of the things I would say to my ladies, whether you're starting with symptoms or you're well into them, realize that you can do exercise and activity any time of your life. It doesn't matter if you're 10, it doesn't matter if you're 100, everybody benefits from it. Being outside, enjoying sunlight, enjoying the greenery of the trees actually has data showing that that's good for our mental health as well. Very tied into what happens at the pelvic floor. So I'm making link after link after link with this. Drinking plenty of water. It doesn't mean you chug a gallon of water. It means your urine should be very pale yellow. It doesn't have to be clear, but if your urine is getting dark yellow, brown, you are dehydrated. And this is bad for muscles. It's bad for bone. It's bad for the pelvic floor, right? So something as simple as keeping your water intake, keep a jug of water at your desk if you have to at work, keep it on your counter at home as you're running around, whether it's taking care of kids or running after the animals, right? So it doesn't matter. It's keeping that water, available to you, or just simple things. And then try to avoid ultra processed foods. And that's basically your sodas and your luncheon meats and things that, you pick up the label and you look at the label and you can't even make out what's in the food, right? It's a chemical factory, basically, right? Those are bad for our health overall, and they're bad for our pelvic floor. That's a whole nother discussion in that alone, but it's just things to recognize that as you go through these phases, take care of yourself, right? And I call it the oxygen mask analogy. It's basically when you're in an airplane, the flight attendant will say when the oxygen mask drops out, you put it on yourself first, not on the child. And a lot of people are kind of, what do you mean? I have to help the child. And it's no, if you don't put it on yourself, you're going to pass out and you can't help the child. Well, life is that. If you don't take care of yourself, you can't take care of everybody else you want to, right? So that's what I'm saying. That's a lot to open up on all that question alone, but you can see there are many, many levels of things that we can do to help ourselves.
Well, I just think it's reinforcing, again, that the body is an ecosystem and that all of these parts that we talk about separately are all interconnected. It's really hard to talk about any organ of the body and not talk about its function in relation to other parts of the body. So it makes sense that the same things with our muscles, right? The muscles in our pelvic floor aren't separate from the muscles in our shoulders or arms. I mean, it's all the same musculoskeletal system. So it really does make sense that what we do for one benefits the other. And it's so simple, but it's also reassuring that everything that we're told to do, and many of us fail at, but the regular activity, whether or not, because they don't even have to call it exercise, regular physical activity, just moving your body and eating a healthy diet, a well-balanced diet, can do so much to help us overall in every area of our physical and mental health, as you said. So that's really important. So as you said, there's so much to do and learn about our bodies and certainly the menopausal transition. And I'm really happy that so many people are talking about it more now. But with that comes a lot of people claiming to be gurus or coaches and all of these vaginal classes and things like that. So when it comes to that, what should women look for or ask when they see information or they're considering someone who's offering training programs or classes in pelvic health? Do they necessarily have to be pelvic health PTs like you? Or what are some questions they can ask about someone's credentials to find out whether or not it's worth taking a course or looking into a program that they might see advertised locally?
Yeah, it's a scary world out there because there are so many people claiming to be experts, in the field. I would say what you do is when you hear something, whether it's, let's say, Instagram or even LinkedIn, although LinkedIn I find has, if you're a professional, has more reliable resources in it. But all of whether it's Facebook, it doesn't matter. What you hear sometimes is these extraordinary claims that this is going to help and that's going to help. What I would say is the first thing is if something seems really extraordinary or you can't believe it, it's red flags. So that's one thing to just look is if someone's claiming they can cure everything, then that's a red flag. Because a true professional will say, we can do this, we can do that, we will work with you, we will help you do this, we will guide you. And these are types of things that work for different people. And we have to kind of find what works for you. So in the pelvic PT world, I might have someone come in the door with the same diagnosis, but I'm going to treat them differently because they're different people, right? So you should see someone who's talking about adjusting to what that person needs, right? That's a big thing to look at. They don't have to be a pelvic PT. In fact, there are some pelvic OTs, occupational therapists in our realm who also treat this. They also can be a nurse practitioner. They can be a physician. One thing that's happening now that's just changing, but I would say we have a long way to go, is there are organizations that are training practitioners to be an expert within the menopausal field. So they have more knowledge on how to help you or put a program together, form a team for you. So I would say look into their credentials and read a little bit. What you can do online is usually you can find, you can look up, oh, this person has said, I'm going to do this, this, and this. And then you can look up and see what they've done. What is their training, that kind of thing. So it might behoove you to do a little bit of investigating behind what that person is and what they do and what their claims are in order to figure out, is this person for real? And are what they telling us for real? I know that's a little complex and requires a little bit of, I'll say, research on the person's behalf, but just be careful what you hear out there. And then there's some great organizations, like the National Menopause Foundation, who's really working hard to get that legitimate, real information out with medical practitioners who have experience in it, not the Hollywood types. And please, please be very careful when you see a Hollywood type really start to espouse some wonderful cure about something. Just please say it's red flags and really investigate it, because there's just so much claiming how well things go. When you do their product or you take their product, it's really more what you can do with the practitioner, how they can help guide you rather than a miraculous product out there.
Yeah. Yeah, that makes perfect sense. And like you said, it's just always look into the credentials for someone. And it's always, if someone has no medical training and they're claiming to be able to help you fix all of your pelvic health issues, then like you said, that's truly a red flag. Well, speaking of like training and information anyway, the National Menopause Foundation, we created a new series of micro courses. And one of the ones that we focused on was the genitourinary symptoms of menopause. And you were one of the faculty. Can you describe for our listeners a little bit about what you and Dr. Hirsch covered in the micro course and how people can find it if they're interested?
Yeah, first, thank you, Claire, for having me be part of it, because it's absolutely wonderful. And it's got such great information that really helps eliminate some of this confusion that we were talking about, and the ability to say, this is what it really is, and this is what you can do about it, right? So what I did with Dr. Hirsch in our section was that genitourinary syndrome of menopause, or GSM. It's a mouthful. But it really discusses the symptoms and the issues that you may have that occur during perimenopause and menopause and even postmenopause. And I say postmenopause on purpose because people have this idea that menopause is specifically this little time period, maybe when you're in your early 50s, that kind of thing. But really, there's an entire time frame before and afterwards. So we talk a little bit about those different conditions. And the most common ones are indeed the incontinence that we talked about before, the pain with sex, the prolapse, and all of those things that are very commonly occurring during that time frame. And we talk about what it means for someone to have these symptoms and feel like they are alone. They're not able to address this because they're the only one with this problem and they're embarrassed by it. They don't want to ask. And then sometimes when they ask their practitioner, the practitioner's kind of like, yeah, it's just something you live with, right? And they don't get good answers back. So that makes them feel even more isolated. So we talk a lot about what those different symptoms are, what the conditions are, and then what it means to get help, whether it's through a nurse practitioner or a physical therapist to specifically help treat it. And the really, really good news is that these conditions can be treated, right? And that's what we want people to realize is please reach out. And even if that very first practitioner doesn't have the answer, go to another practitioner. And if I may, so my book, The Musculoskeletal Mystery, How to Solve Your Pelvic Floor Symptoms, talks about what the conditions are and links all the wonderful things we talked about the musculoskeletal system it links it together and why you get these symptoms and then what you can do about it and what the team is. And a couple of times I've mentioned reaching out for a team because these conditions require, most often, not always, a team. So it means that the patient's kind of the center of that team, and they may have a physical therapist, they may have a physician, they may have a nurse, they might have a sex therapist, they may have an acupuncturist, they may have a massage therapist. So you see what I'm saying? It's a bunch of people treating these conditions to help bring the whole health of the person back so that they can do what they were doing before and they don't have to feel like their life has stopped because of menopause symptoms.
Well, yeah, and I loved the course that you and Dr. Hurst did, and it made me so happy because it's such important and good information. And I realized that anybody with a computer can access this information and hear from experts like you, where again, sometimes it's really hard in certain areas to find someone who can specialize in this. But at least if we know the basics and we know what to ask, and we can, as you said, identify that, oh, this is not normal. This is happening to me, and there is something I can do about it, makes all the difference in the world. So I'm so grateful that you both took the time to be part of those courses. We also do one on vasomotor symptoms of menopause and sleep deprivation, really big symptoms that women face at menopause. And we hope to be able to work through all of the other symptoms as well to kind of give it the same sort of deep dive educational information. So definitely encourage those of you who are listening to visit our website and get more information. And we'll put information about those courses and obviously about everything that Ingrid does in our notes with this podcast so that you can be sure to reach out. So as you know, we have an online community. And prior to bringing you back on as a guest, we reached out to the community and said, what kind of questions do you have for Ingrid? And so some of the ones we've discussed already are from our community. And I appreciate everyone sending in their questions. We had one that was really interesting. It was very specific, but it's also those kinds of things that, again, it's really hard to find the information if you don't know or have access to someone. So the information that we collect is anonymous. The online community is an opportunity for people to share their journey for peer-to-peer support. And one of the questions was related to prolapse. So I want to have you explain what that is, first of all, and then why it happens and how it's treated. And then I'll come back and ask this specific question that we had from our community member.
Absolutely. So prolapse is something that, for the most part, it's not a life-threatening condition, but can be extremely scary when someone first discovers it. So basically, before we talked about the hammock or sling, which is kind of a good picture to have in this case as well, because that hammock or sling holds up your organs through your life. So what happens for some folks is when they lose some of the muscular support or ligamentous support from inside, one of the organs, so I'm going to start with the bladder because that's pretty common. The bladder actually can start to fall into the vaginal canal and start to push the skin of the vaginal canal forward and then eventually out of the vaginal canal. So what happens is the woman feels like a bubble or something like a ball that starts to form at the opening of the vagina. And that can be very scary because if someone doesn't know what that is, they can say, oh my gosh, I've got cancer. Something's growing there, right? It can retreat. It can push back out further. If someone's doing a lot of physical exertion and they're really pressurizing their pelvic floor because they don't know how to use their pelvic floor right, then that ball can protrude out even further. And this can happen for the bladder. It can happen for the uterus. It can happen for the bowel. It can even happen for the small intestines. But for the sake of the conversation today, the bladder, like I said, is one of the most common ones where this can happen. A lot of folks they may have incontinence and the incontinence starts to go away a little as that bladder really starts pushing down and clamping down on the urethra that's the tube we pee out of. And then if it protects up, the incontinence comes back. So it could be like an incontinence that comes and goes with prolapse as well. The skin of the vaginal canal that protrudes out can get very irritated as well. So it can cause irritation and discomfort because of that. And then lastly, people are very afraid to have intercourse because they're afraid that they're going to hurt themselves with it. So there's a lot that goes with this. And the brief mention that I made of if someone doesn't know how to use their pelvic floor correctly or even their core correctly, what happens is someone constantly pressurizes their system. It would be like holding their breath and bearing down all the time. They can create more and more prolapse over time, or if they have constipation. So constipation is a huge issue that occurs in tandem with prolapse. And someone who's always straining to have a bowel movement can also create more pressure on the pelvic floor and creating more of this prolapse kind of sensation. So you can see it can be a very scary thing. It can be a life-changing thing, but not necessarily like a life-threatening condition. And the good news there, it can also be treated, right? So as a pelvic PT, what we can do is A, we make the pelvic floor stronger to create the support system. B, we teach someone how to have a good bowel movement or a proper bowel movement. We teach people how to lift and carry and sneeze and cough without creating pressure on the pelvic floor. So on the one end, we try to make things stronger to help get rid of the symptoms, but the other, we change what they're doing in their life in hopes of reducing the pressure that creates the prolapse to begin with. So there are a lot of different directions. And then just like everything else, we talk about overall activities and exercises and diet and everything that will help reduce, let's say, constipation, right? We want that person not to go through straining, so we don't want them to have constipation. And that's a very pelvic floor driven issue that people think it's just what I eat. No, it's not just what you eat. It's also what your pelvic floor does. So these are just things to recognize that we try to treat and help in helping someone within pelvic floor PT.
And is there also like surgical or medical interventions that happen when people have severe prolapse?
Yes, indeed. So when prolapse progresses far enough, sometimes we cannot solve the problem, right? So in that instance, yes, absolutely, surgery is an answer. What we like to try to do is have some PT maybe before and after, because what we do is if you had the surgery and this beautiful work done, and now you feel a lot better, but you're still doing the same things you were doing
Right.
before. One example, I had a patient who she had a trailer with like a dog. She would do all the shampooing and all the work for dogs, but she would go to people's houses to do this, right? She had to lift, 80, 90, 100-pound dogs and put them in and out of sinks and do all this. So she did heavy, heavy lifting. No one taught her how to do this correctly. And my concern was she had this wonderful surgery and now she's going back to the same techniques without knowing how to protect her pelvic floor. So we went through a lot of process of how to get stronger and how to lift properly so she wouldn't injure her pelvic floor again, right? So it's all these things that are so, so important to realize that, yeah, the surgery can be awesome. And I've had many patients have it and they do so well with it. But we need to work with that team once again so that we keep someone good. We keep that surgery in that awesome category. So yeah, there are different things that can absolutely be done for someone with prolapse.
Yeah. It's so interesting. And I think that's something that is really important for people to think about as well on any kind of surgery. When physical therapy is offered, either pre or post surgery, and even post surgery, where you think you've solved the issue, right? If it's offered and if it's covered by your insurance, please take it. Please, please, please take advantage of every opportunity to do the follow up. Because as you said, there's so many things where, great, the surgery was fantastic. But like you said, we might be going back to the same habits, doing the same things. I know personally, when I had my cervical spine surgery and I was like, no, I'm good. My range of motion is fine. It's all that great. And now a year and a half later, I realized my range of motion in my neck is not nearly what it was. And had I done the physical therapy right away, right, and worked through all of that, it probably would have been better. And it's not too late. But those are the kinds of things that, again, we're like, oh, I just can't deal with one more thing. I had the surgery. It's done. I don't want to think about it. And really, we have to follow through and take advantage of that and the expertise that physical therapists offer for all of these different sections, whether it's orthopedic or whether it's pelvic floor, et cetera. Please, just encouraging anybody listening, if you have the opportunity to follow through and do the physical therapy, do the physical therapy. You will never regret it. Okay, so last part of this question then, as we wrap up another fabulous, interesting section, this member of our community has said that she did have a recticile, so a type of prolapse, and had a pessary installed. And she wanted to know how often it should be removed and cleaned, because that's not something her clinician just said, come back in 3 to 6 months or something. And she thought that seemed like a really long time to go without cleaning the pessary.
Yeah. Okay. So I'll start by saying there are many different kinds of pessaries, many, many, many different kinds. And different kinds require different care. So there are some that you as the individual can take that pessary in and out every day if you want. You can take it, or you can put it in for certain activities and leave it out otherwise. Then there are others that are left in for a little longer period. And there are some that are left in, yes, longer, and a practitioner will take it in and out. The thing is, someone really, really has to watch for is if it becomes painful at all, there's an odor coming from it or a discharge, immediately go back to the practitioner. And I would say, this particular person probably should call their practitioner and say, hey, am I supposed to leave this in for this whole time period? And then at 3 months, we'll take it out, or should I be taking it out? I wasn't clear on the instructions kind of thing, because it's something that sometimes the practitioner assumes the patient has it all in their head and they go out the door, and they don't. And, this is why I say to patients, take your piece of paper, write your questions down, be old school about it, bring it in with you and say, okay, I've got these questions, right? Most practitioners these days really welcome someone asking the questions, because it leads to much better care. It really, really does. But I would call back just to make sure. But yes, some of these do stay in for months at a time. So it really depends on the pessary itself. But please listen to those red flags, because if those red flags have the discharge or the smell or pain at all, that's something that someone needs to look at to make sure that pessary is actually fitted and sitting in there correctly.
Oh, that's really good. Great advice.
Yeah.
And like you said, it's okay to call back and say, you know what, I didn't quite understand the instruction, or can you remind me about this? Because it's a complicated system, and we're not necessarily, again, when you're so confused or worried, or you're concentrating on the post-surgery information, it can all get jumbled up. So yeah, it doesn't matter when, just call back and ask. So I think that's really, really terrific advice. So Ingrid, I know we're going to be having more sessions with you, because I learned so much every time we talk. And as I said, I'll have information about the MicroCourse that you did, and information about your book, and links to all of the resources we've talked about today with the notes of this podcast. And thank you so much for sharing your expertise again. I really appreciate it.
Oh, thank you so much for having me. I really enjoy our conversations. They just cover so many great topics, and the more we can help people, the better it is.
Me too. I'm really thrilled that people have access to you through this podcast. So thank you so much. I hope everyone has enjoyed this podcast episode. And if you do, please subscribe to The Positive Pause so you never miss an episode. And please share the information about this podcast with your family and friends. So many people are in need of this information, and we really would love to be able to reach them wherever they may be. Thanks again to my guest, Ingrid Harm-Ernandes, and thank you for listening. We hope you'll tune in to another episode of The Positive Pause.